Hello, everyone. Drew Watts with Restorative Oxygen Care. And today we're going to be looking at a paper out of the International Journal of Urology from 2020, where the researchers looked at hyperbaric oxygen therapy for radiation cystitis after pelvic radiotherapy. This paper, I believe, is open access, so you can Google the title and you should be able to find it if you want to read more about it. I will also say that hyperbaric oxygen therapy is approved for the treatment of radiation cystitis. Okay, so let's get down to this. So there were a total of 20 papers they looked at with 815 total patients who were treated with HBOT for radiation cystitis. You can see the overall and complete response rates were very good. The weighted average of the overall and complete responses were 87.3 and 65.3% respectively. So that's very good. Some of the prominent limitations they note here in their abstract was high cost and low availability, and we'll address that a little bit later. But they do say that hyperbaric oxygen therapy is effective in the treatment of radiation-induced cystitis with minimal adverse events, but low availability and high cost. So I think this high cost is a perceived high cost, and we're going to look at an abstract in the second part of this video where it actually shows a cost savings for hyperbaric oxygen therapy when used to treat radiation cystitis. And our team at Restorative Oxygen Care is dedicated to trying to increase the availability of hyperbaric oxygen for a variety of conditions so we can obviously improve patient outcomes, but also learn more about different conditions and how HBOT may influence those outcomes. All right, so radiation cystitis is an injury to the bladder, obviously resulting from pelvic radiation therapy. So these things might be bladder cancer, prostate, cervical, endometrial, rectal, and some others. And we know that radiation therapy is getting better at targeting these tissues, but there's oftentimes, regardless, there's some type of damage to healthy tissues. So this is something I mention to radiation oncology teams quite often, is that radiation cystitis can be a complication of radiation doses starting from 45 to 55 grays. That's the amount of radiation delivered. And that risk increases significantly at a cumulative dose of 60 grays. So that's sort of like a magic number. Like we can kind of predict that there will be some type of tissue damage there if we see radiation levels at these points. So some of the symptoms that we might see in patients are frequency, nocturia, dysuria, pelvic pain, discomfort. Can also be urgency, infections, retention, and hematuria, which is blood in the urine, which is one of the major things that we look at with radiation cystitis. Many of these patients who have radiation cystitis will come to us years and years following their radiation, and their urology team has tried a variety of different things, which may or may not have been successful up to a certain point, or they could be refractory where they're not getting great results. And those things are like a bladder irrigation, coagulation, embolization, things like that. And then we usually find that HBOT is tried as like a second line or third line approach. And I think one of the things that they looked at in this study hypothesized was, could HBOT be utilized earlier as opposed to later for the treatment of radiation cystitis? So there are a bunch of tables here. Again, you can look through these if you like, if you want to look it up. These are the patient characteristics, so their ages, sex, what were their primary tumors, where was their cancer site, how much radiation did they receive, and so on. These are the details about the HBOT. Again, these are some of the pressures where we treat, the duration of each session, the mean time, so how long had they been dealing with hematuria before they got HBOT, and so on. So the main crux, I guess, of this paper is that they were looking at showing that HBOT is effective, and again, it is already approved for it, but they're just looking at other factors that can come into play and why patients maybe didn't have the best outcome, and they think that that could be how much radiation was received or delivered to the pelvis, the time to get HBOT from the time they were diagnosed with hematuria, and some of the other severities that they had been dealing with, and maybe even some of the treatments that they had received. It might have actually damaged the bladder tissue themselves. So, um, again, HBOT is approved. It is very effective. We have great success with patients in our facility. But again, one of the things they mention here is the cost can be a little bit of a challenge, they think. So, in the second part, you'll see where I can show that they actually demonstrated that there was a fairly significant cost savings and patient outcomes were improved while utilizing HBOT for radiation cystitis. This is the second part to sort of addressing the cost of hyperbaric oxygen for radiation cystitis. Again, you can see this one came out of the Undersea and Hyperbaric Medicine Journal 2024, so that's this year, second quarter. So they looked at CMS data and showed a cost and clinical advantage for utilizing hyperbaric oxygen therapy for radiation cystitis, meaning it saved money and the outcomes were improved. So, again, I apologize. I don't have the full study on this, but I do have the abstract. So, increasing cancer survivorship in part to new radiation treatments has created a larger population at risk for delayed complications of treatment. Basically, that means because cancer treatments are getting better, patients are living longer, but that also means that they then may incur some of these side effects later, years after treatment. Radiation cystitis continues to occur despite targeted radiation techniques. So I'll try to get through this one really quick. If they showed that there was a 36% reduction in urinary bleeding, 78% reduced frequency of blood transfusion for hematuria, and a 31% reduction in endoscopic procedures, fewer hospitalizations when study patients were compared to control, meaning people that did not get HBOT. There was a 53% reduction in mortality and reduced unadjusted Medicare cost of just over $5,000 per patient within the first year after completion of HBOT treatment per patient. So Medicare per year, just in the first year, they saved over $5,000 per patient. When at least 40 treatments were provided, cost savings per patient increased to about $11,500 for the HBOT study group compared to the control group. So this represents a 37% reduction in Medicare spending for the HBO treated group. So what does that mean? The previous study that we were talking about in this video mentioned the cost, that it was could be a barrier. This shows from CMS data that if hyperbaric oxygen therapy is included, it will actually demonstrate a cost savings and provide a clinical advantage for outcomes for the patient. So I hope you guys learned something from this. Again, we do see very good success treating radiation cystitis with hyperbaric oxygen therapy at our facility in Lexington. If you have any questions, please reach out to our facility. And as always, if there is another condition that you would like to see covered, please let us know. You can put it in the comments. We will try to address those as they come about. Thank you guys so much for paying attention and listening, and we'll talk with you soon.